Hi everyone. So my surgery coordinator contacted me, and this is the same coordinator that called me saying that I was approved for surgery. You have a case manager with Orlando Health. You have a case manager, and then that case manager will send you to the surgery coordinator. And the surgery coordinator kind of tells you, hey, this is your surgery date, and she'll send you your surgery itinerary. So for my job, I'm actually going to do a short-term disability, and they actually send you everything that you need to fill out that short-term disability guide. So I highly recommend, before you even start talking about surgery dates while you're seeing your surgeon, with your job, go ahead and check if you have short-term disability. Why? Because you don't have to then take PTO. You can do a short-term disability with your job, and you get paid your regular income based off your hours by the short-term disability process. So check with your employer. But with my surgery itinerary, what I have here, my surgery date is June 1st. So May 24th, I'm actually around 9:30. I'm going to see my surgeon and my bariatric coordinator. With that being said, they state here that this is when I'm going to be filling out the surgery. Well, let me explain here. It says, be prepared to be at the office 2 to 3 hours. This is going to be my surgery review. On the 24th, you'll receive hospital education from your bariatric coordinator. You'll review risk and complications with your surgeon and sign your surgical consent. They also provide you a number, meaning prepare for your financial responsibilities. I've already been in contact with my insurance. I am not paying anything out of pocket. Everything is covered by my insurance. It's just what I have: United Healthcare, PPO. I reach my max deductible because I see a psychiatrist and I've gone to the doctors and all of this stuff. I reach my max out of pocket. So talking about insurance very quickly, going back, in order for you not to really pay much out of pocket, you need to reach your max out of pocket. So let's say your max out of pocket is $1,600. You want to make sure that you reach that. That's by paying for your medication, paying for your copay fee. If you're seeing like your doctor, if you're going to an urgent care, if you're getting blood work done, all of that goes into your insurance as your deductible. And so my max deductible was $1,600. And my max out of pocket for self was $800. So with that being said, I don't have to pay much. So I kind of know that, they say be prepared for your max out of pocket costs. You'll be emailed your surgeon fee, which will be collected during your upcoming visit. So girl, make sure you know that how much you paying, because can get expensive. And for the short-term disability guidelines, you normally can return to work for 2 weeks unless you do heavy lifting, pulling, or pushing. I work with children with autism. So I work actually with the high intensity clients that engage in maladaptive behaviors. So I'll need to be out of work for 4 weeks, and that still counts as short-term disability. So your employer will have you fill out their short-term disability form, their claim, and you'll send in this appointment, or you can fax it. I already faxed it to her, but you can go with the form at your appointment. They fill everything out, then you send it to your job, so that while you're recovering, you're getting paid and you're not really worrying, oh my God, what do you have to do? You want to kind of like prepare for a worst case scenario. And then I will also be going to, this is the pre-admit testing appointment the same day. So at 9:30 is my first appointment with the surgeon filling out the consent. My second appointment is at 12 p.m. And it is actually the building across the street from me. And they said that would include a chest x-ray, special labs for anesthesia, and an EKG to compare the one you've already had done. So I guess that's pretty much it. I'm gonna be there all day, but it's fine. And then it kind of goes to start your 2 weeks before surgery, which is your liquid diet. So here it says, in order to reduce operative risk, a weight loss of approximately 10 to 15 pounds prior to your surgery is recommended. To achieve this weight loss, you'll follow a modified diet for the 2 weeks prior to your surgery. The purpose of this diet is to reduce the amount of fat stored in your liver. This diet will consist of replacing 2 of your meals with liquids, with liquids, and avoid high fat and heavily processed foods, lightly carbonated intake. Let me tell you, after the surgery, you can basically not have any carbonated stuff. So I've already stopped everything carbonated about 2 weeks ago. This is my first week. I'm on day 4 of the pre-op liquid diet. So, girl, just stop. Don't take any carbonated stuff. And then the day of surgery, it says you can have a light breakfast and a protein drink for lunch, and after, only clear liquids. That day I actually took off because with this, like, you're not eating anything. You're just drinking. And then the day of surgery, you can have liquids up to 2 hours before your before hospital arrival. So that means the hospital may not give me anything. Interesting. So yeah, and if you have any sleep apnea, they tell you please bring your CPAP settings with you for the date of surgery. Please come prepared. We ask that you come early in case of an emergency. Surgical times may change. And then they give you I love how organized they are. They give you a list of, please discuss the following information with your medical provider. This is all medications will be crushed, chewed, or in liquid form for 4 weeks after surgery. They tell you about extended releases and what you have to do with that. Meaning your psychiatrist or your doctor has to change all of your medication to a crushable form or liquids. I have my appointment with my psychiatrist on Monday because I do take sleeping medications, which is extended release, and yeah, boo, I'm gonna need liquids. And then blood pressure medication. So with this, I don't have it, but they say that they're able to, due to limited intake, limited mobility, and prescribed pain, nausea, and medications, patients are discharged with instructions to take half of their normal dose of blood pressure medication. And then you have the blood glucose medication. 2 weeks prior, you should be instructed to begin a strict high protein. This is so that you, after surgery, at least for 2 days, you're not taking anything. And they say metformin will be held for 2 days prior to surgery. And then they talk about blood thinners, how they have to be stopped 2 weeks prior to surgery unless your cardiologist approves of different instructions. They say aspirin to be avoided in all gastric bypass for life, as these can cause ulcers. I'm never going to be able to have aspirin, but that's okay. My wife is allergic to aspirin, so that's fine. And then stop all herbal supplements 2 weeks before surgery. Stop hormones like birth control pills or testosterone replacements for 4 weeks before surgery, and stay off them 4 weeks after surgery. A total of 2 months. A barrier method of birth control is highly recommended. Now, during this, like they say you can have sex, but they don't recommend sex, but they said, still just in case, have a different method of birth control pill. So that's probably like the cup, or I don't know. And then stop all diet medications. Hence Wegovy. Thank goodness. I don't like that medication. But yeah, just kind of wanted to keep you guys updated on what I received and what information I received. Like I said, I'm really type A. So I have a lot of information. It's more of, if you have a question, just put it in the comments and I guarantee you that I can answer it. And I have sources, meaning my care coordinator, she's very nice. She's very responsive to me. So like I will even ask her a question for you. So don't worry about it. Let me know.